Thanks to effective treatment, more people with HIV are aging than ever before. If current trends continue over the next 15 years, we expect 20 million people living with HIV will be over 50 years of age and account for over half of the entire global population with HIV. Importantly, 96% of these individuals will be living in low and middle income countries. While we celebrate this fantastic success, longer lives bring new challenges. In part due to the virus itself, people with HIV experience age-related conditions earlier than those without HIV, including cardiovascular disease, liver disease, and several forms of cancer. Many also face double stigma from HIV and from aging itself. Building on a growing body of research, the Lancet HIV Commission has produced a scientific report recognizing the importance of this topic. In close collaboration with an international panel of experts and community representatives, we offer actionable recommendations for health policy, community programs, clinical care, research, and most importantly, for those people living with HIV to support aging well around the world.
Aging with HIV is not just about adding years to life. It's about having the support to live those years with stability, dignity, and care. At 68, I am a 36-year long-term survivor aging with HIV. My top health concerns are mobility, memory, emotional well-being, and navigating multiple medical specialties. Since my diagnosis in 1990, I have come to realize that my emotional well-being primarily affects whether I consistently make my medical appointments and consistently take my medications. So having to navigate 3 complex medical specialties, HIV, aging, and mental health, can be overwhelming at times. Peer navigation is a lifeline that can turn a maze into a pathway to viral suppression, wellness, and quality of life. Thank you.
I've lived with HIV since 1994. That is 32 years now. This year, I am 66 years of age, and I definitely feel 66. My most pressing health concern is caring for my deteriorating kidneys and joints. My greatest unmet health need is my ability to pay for increasing medical expenses for the various clinics that I am going to now, for consultation, for treatment, and for medications. The change I want to see to help me age and thrive with HIV is access to affordable medical insurance coverage, as well as shelters, retirement homes that readily accept PL-HIV without discrimination.
In hindsight, I've lived with HIV for 40 years because I think I got infected around 1986. I'm 73 years old, but I feel like 60 or 65 years old actually. I'm fairly healthy. I don't have a serious health unmet need now. I'm on the ARVs, also diabetic, but the diabetes is controlled on treatment. Currently, my most pressing health concern is the funding. Most of the funding is from donor, and the problem is that my country has not invested enough into health. So I would love to see more of that if I'm to live and thrive with HIV as I age. Thank you.
With this report, we're calling for a meaningful shift in how we care for people aging with HIV by thinking about their lives in 3 stages. First, the early stage, establishing that patient-provider relationship, achieving viral suppression, addressing threats to HIV treatment adherence and to healthy aging. The middle section, the decades of aging with HIV, focusing on establishing and maintaining both mental and physical health. And then finally, in the 3rd stage, when there's about a decade left of survival, transitioning to dignified support and care with shared patient-provider decision-making and a focus on mobility, cognition, and end-of-life planning. Most health systems are not ready for this paradigm shift. So we are calling for integrated models of care that link the clinics with both community organizations and digital health tools that are culturally appropriate. Please enjoy the recommendations, all of which are actionable in our report.